Okay, so today I want to talk to you about low back pain that you can have, which sometimes isn't actually low back pain as much as it is muscle weakness in the hip, and it actually is really hard on the SI joint. So the SI joint is the sacrum is the triangle bone, the ilium is the hip bone, and the joint there is SI joint pain. And a lot of people will get that, and it can be secondary to muscle weakness. So we want to talk about how do we identify that, and then how could you potentially strengthen it. And so these two big points right here are the PSISs, and so the reason that they're important is they're big and large and you can feel them. So if you feel in your lower back and you feel this big bone that sticks out on either side, when you bend forward it tends to stick out more, that's the PSIS. And what happens is if you're really sore right there on that bone or even to the side slightly, that can be the glute medius is the name of the muscle. And it's this muscle that sits underneath the glute maximus, so you've probably all heard of that one, but it's the medius. And what this muscle does is it abducts your hip, meaning it has your hip move to the side. But the other thing that the muscle does is it keeps your pelvis level when you walk. So when you walk, it keeps you straight and level. We live in a culture where we do a tremendous amount of sitting, so a lot of people have weakness in these muscles because of how they sit. Even really strong bodybuilders can have weak glute medius muscles. One of the ways that you might see that, if as a person is walking and one of their hips drops all the time when they walk, you can kind of see their hips go up and down. That's because of glute medius weakness. Your hips should stay level as you're walking because those muscles are going to hold it up. So an easy way to identify if that's the problem that you have is find these big bones that stick out right about your belt area, and when you lean forward, these bones should stick out, and if it's really sore right there, you can work on this exercise. If you see some results pretty quickly, you know what you're dealing with, and you know that this is going to help. If not, it's more of an SI joint issue versus a muscle issue. So a couple things we're going to do to strengthen the muscle. The first exercise is you're laying on the floor, you're just laying on your side like this, and we're going to isolate and strengthen this muscle. And so again, if you feel that big bone sticking out on the back of your hip there, you can put your thumb on it so you know where you're at. But what we're going to do is you're going to take your leg, you're going to bend your knee, touch the ground, and then you're going to extend it straight back, toe pointed slightly down, and then raise it up. And you'll feel it get kind of tight along the back part of your buttock or even down your leg slightly. And then you come back down again. Touch the ground, come back into extension, and then up. And I should actually have some more room because we're going to go further into an extension. So touch the ground, back into extension, up, and you'll do about 10 of these, and you're going to really work this muscle. And a lot of you are going to feel how sore it is. Once you've done that, wait a few seconds, catch your breath, and then we want to fatigue this muscle big time. And so you're laying in the same position. You're going to put your leg back slightly, raise it up, toe pointed down, and then just hold this position for as long as you can until you can't hold your leg anymore. This may be 10 seconds, it may be 30 seconds, it may be a minute, but a lot of you are going to have that weakness, and once you start shaking and you can't hold it, then bring it down. So you do 10 of these, and then you fatigue the muscle, then do the other side. Once you've done those two exercises, we want to continue to strengthen these muscles here. And so what you do is you get against a wall, just put your arm out so you know that you're nice and level against the wall. And then what you're going to do is raise your leg up. And once you raise your leg up, this muscle is contracting to prevent you from falling to the side. And so what you're going to do is you're going to let your body fall to the side slightly, and then you're going to go up and almost put your hip towards the wall. Let it drop down and go up and put your hip towards the wall. And you're going to do that about 10 or 15 times, and what that's doing is it's strengthening this glute medius muscle. Can you see that pretty good? Mm-hmm. Okay, so you do that on one side, and then you'll switch to the other side. Same thing, your arms just so you know that you're right up against the wall, leg up, drop that hip out, and then come up towards the wall. Drop the hip out, come up towards the wall. These exercises will really strengthen this glute medius muscle. If this muscle is really sore, you can do these and see almost immediate relief. If you're doing these exercises and you don't see hardly any change, then we know that we have more of an issue with the SI joint, and that's something you want to talk to me about in the office. Okay, good luck.